Welcome to the deep dive. You know that phrase, it's all in your head? What if that wasn't a dismissal, but actually key to unlocking some pretty profound physical changes in your body? Today, we're diving into something often misunderstood, maybe even sidelined a bit, but research shows it's a powerful, measurable force, the placebo effect. But we're going to reframe it, give it a name that maybe captures its essence better. Neuromanifestation. It's really about the astonishing way your thoughts, your beliefs, your expectations can literally impact your biology. Yeah, our mission today is to move way beyond that old idea of fake healing. We're going to walk you through some rigorous evidence, surprising statistics, and really deep neurobiological insights from the research. This deep dive, it's designed to give you a clear, comprehensive, and honestly kind of mind-bending understanding, helping you connect the dots between mind and body in, well, not maybe a whole new way. Get ready to rethink what you thought you knew about healing. So let's kick things off right there. When most people hear placebo, they think sugar pill, right? Something inert, something that doesn't really do anything. But the studies we've looked at paint a completely different picture, don't they? What's the fundamental shift we need to make here?
You've absolutely nailed the core misconception. What these sources reveal is that the placebo effect is, well, it's far from inert. It's actually a complex dynamic interplay between our neurobiology and our psychology. It's really about how our expectations, our beliefs, and the whole context of a therapeutic experience, the ritual, the interaction, can trigger measurable, observable changes, and not just in how we feel symptoms, but sometimes even down to our brain chemistry.
Okay, brain chemistry. That changes things.
Exactly. And that's why neuromanifestation is such a useful term, I think. It clarifies we're not just talking about wishful thinking. We're talking about the actual transformation of a thought, a belief, into, quantifiable, observable outcomes in the body. And crucially, this isn't just psychological. It's biochemical reality, a tangible response happening inside the brain. It fundamentally shifts how we see that mind-body connection.
Okay, biochemical reality. That definitely changes the game. So if we're saying that, let's unpack some of the incredible data that supports this. The research you've shared is really compelling, showing just how robust this effect can be across different conditions. Where should we start to really see this in action?
Well, let's start with pain. It's arguably one of the most subjective experiences, right? But there are these groundbreaking meta-analyses, really well-respected studies. They've shown that while placebos might not dramatically change, say, the objective measure of an injury itself, they create a moderate, measurable difference in how people feel their pain. Subjective pain.
So noticeable.
Definitely noticeable. We're talking effect sizes usually between 0.2 and zero point 0.4 standard deviations. And, placebo analgesia, that pain relief, is so robust, so consistent, that researchers actually use it as a standard benchmark, a comparison point in experimental pain studies. That's how real it is to them.
Wow, okay, so it's not just a flicker, it's something they measure against. But what about something like depression? Some might argue, isn't that just a convenient way to dismiss someone's struggle? Oh, it's just the placebo effect. How do these studies challenge that?
That's an excellent point and a very common concern. But when we look at antidepressant trials, the statistics are, well, they're genuinely striking. Research consistently shows placebo response rates averaging around 30 to 40%. That's quite high.
30 to 40% improved just on placebo.
That's right. Now compare that to the active drug response rates, which are typically around 50 to 55%. So do the math. The placebo effect accounts for a huge chunk, something like 60 to 70% of the total observed improvement in these trials.
60 to 70%, that's huge.
It is. But here's the clincher, the neurobiology bit. Brain imaging studies show something remarkable. The placebo antidepressant response actually activates the same key brain regions involved in mood regulation, these prefrontal limbic circuits, almost identically to how actual antidepressant drugs work.
Whoa, okay. So it's not just feeling better, it's actual measurable changes in brain activity that look like the drug's effect.
Precisely. So no, it's definitely not a dismissal. It's a real physiological change mirroring the medication's action.
Okay, that really does challenge the conventional wisdom. But here's where it got even more mind-blowing for me in the research: Parkinson's disease. We're talking about very concrete physical symptoms there. What did the studies show?
Absolutely. Parkinson's provides some of the most compelling evidence. There are these PE scan studies. They let us actually see brain activity in real time. And they've shown that in patients with Parkinson's, simply administering a placebo, telling them they're getting a helpful drug, even if they aren't, can trigger a release of dopamine.
Dopamine, the neurotransmitter involved in movement.
Exactly, a release of dopamine in the striatum, a key brain area for motor control. This isn't just someone reporting feeling a bit better. It's a direct, observable biochemical change. We can see the dopamine levels increase on the scan.
And does that translate physically?
Yes, this dopamine release leads to measurable, though often short-term, motor improvements for the patient. It's such a clear instance of belief or expectation manifesting as a tangible neurochemical change.
That's astonishing, a direct biochemical change from something inert. But it's important to understand the limits too, right? This isn't magic. Are there areas where this neuromanifestation hits a boundary? What about something like, say, asthma?
That's a critical distinction, absolutely. The mind-body connection is powerful, but it doesn't just override all physiological realities. Asthma is a great example. Inhaler trials consistently show that patients using a placebo inhaler often report feeling significantly better. They say their breathing feels easier.
Okay, so they feel better subjectively.
Right. But when you take objective measurements like AVV, forced expiratory volume in 1 second, which is a standard test of lung function, those physiological readings, they typically remain unchanged. The amount of air they can actually force out doesn't improve.
Ah, I see.
So it clearly illustrates that while our subjective experience can be profoundly altered how we feel, the underlying objective physiological condition might not always follow suit. It highlights that difference between symptom perception and measurable biological function.
That makes perfect sense, that distinction. It's not always changing the underlying disease, but changing the experience of it. Okay. But what about something really concrete, really invasive, like surgery? Can belief actually influence the outcome there, where the physical intervention seems so dominant?
Yeah, this is where some of the most paradigm-shifting findings come from. There's a truly groundbreaking study you probably saw involving patients with knee osteoarthritis, really painful, debilitating condition. They randomized about 180 patients into 3 groups. Group 1 got real arthroscopic surgery, scraping and cleaning out the knee joint. Group 2 got a lavage, just washing out the joint. And Group 3, they got sham surgery.
Sham surgery, what does that even mean?
It means the surgeons made the standard incisions, manipulated the knee as if doing surgery, talked like they were doing surgery.
Mm.
But they didn't actually do any repair inside the knee. They just closed the incisions back up.
Okay, so what happened?
The results, tracked over 24 months, were absolutely astounding. There was no significant difference in pain relief or improvement in function among any of the 3 groups.
Wait, no difference? The sham surgery group improved just as much as the real surgery group.
Exactly. All 3 groups improved to similar degrees.
Yeah.
It was a powerful demonstration of what some call the ritual effect of surgery. The belief, the expectation, the whole elaborate therapeutic setting, the attention, all of it seemed to have as much impact on patient-reported outcomes as the actual invasive procedure itself, at least for this condition.
No difference. That really stops you in your tracks. It makes you rethink the power of ritual and belief in so many things. But, okay, that relies on the patient thinking they got the real deal. What happens if you take away the deception? What if people know they're getting a placebo? Does it still work?
Now you're getting to perhaps the most revolutionary concept in this field. Open-label placebo, or OLP. This is exactly what you said. Patients are openly told they're receiving a placebo. They know it contains no active medicine.
They know it's a sugar pill, basically.
Essentially, yes. Or they're told this is a placebo, like a sugar pill, containing no active medication. And then they're often also told something like, however, placebo pills like this have been shown to produce significant healing effects through mind-body self-healing processes.
Okay, so honesty is key. What happened?
Well, a really famous trial at Harvard looked at this with patients suffering from irritable bowel syndrome, IBS. They gave one group these openly labeled placebos with that explanation. And compared to a group that received no treatment at all, the OLP group reported significant improvement in their symptoms.
Even knowing it was a placebo.
Even knowing. It completely upended that long-held assumption that deception was essential for the placebo effect. And it wasn't a one-off. Replications in other conditions like chronic low back pain and even cancer-related fatigue have confirmed OLP's effectiveness. They typically find moderate effect sizes, around 0.3 to 0.5, showing genuine improvement even when patients are fully aware. It suggests our capacity for self-healing might be more accessible than we thought.
Wow. Okay, so we know it works, even without deception sometimes. We've seen these incredible examples across pain, depression, Parkinson's, even surgery. This is the million-dollar question then. How? How does a belief, an expectation, actually translate into a physical change? Can you walk us through the biology? Let's start back with pain. How does the brain actually create that pain relief?
It's truly intricate, but also incredibly elegant when you see the pathways. For pain relief, the key mechanism involves the release of your brain's own natural painkillers. These are substances called endogenous opioids. Think of them as the body's internal morphine, produced on demand.
So the brain makes its own drugs.
In a sense, yes. And we know this is central because of a drug called naloxone. Naloxone is an opioid antagonist. It basically locks opioid receptors, like an off switch for opioids. If you give someone naloxone before giving them a placebo for pain, the placebo effect is significantly reduced or even completely blocked. The pain relief doesn't happen.
Ah, okay. So blocking the opioids blocks the placebo effect.
Exactly. It's strong evidence that this isn't just some vague mental trick. It's a demonstrable physiological response involving your body's own potent opioid system.
Fascinating. So the brain isn't just ignoring pain signals, it's actively dampening them with its own chemicals. What about those motor improvements in Parkinson's? How does that link biologically?
That's linked directly to the release of dopamine in the striatum, as those PET scans showed us. The expectation of receiving a beneficial treatment, even if it's a placebo, seems capable of stimulating these dopamine pathways in the brain.
And dopamine is crucial for movement.
Crucial for motor control, yes. So an increase in its release, even a temporary one triggered by placebo, can lead to those observable improvements in movement. Another powerful example of expectation influencing complex neurochemistry.
Okay. And mood. You mentioned the placebo response activates similar circuits to antidepressants. What's the mechanism there?
Right, for mood regulation, the placebo effect seems to engage those prefrontal limbic circuits we talked about earlier. These are brain areas deeply involved in emotional regulation, controlling impulses, and higher cognitive functions. When the placebo response activates these circuits, perhaps through expectation or belief, it helps modulate emotional states. Much like how many SSRI antidepressants are thought to work, it's like a top-down influence.
Top-down, meaning higher brain functions influencing deeper emotional centers.
Precisely. Higher cognitive functions like expectation and belief are actively regulating the activity in these deeper emotional centers.
So our thoughts are literally sending instructions down to the parts of our brain managing mood.
Okay, and finally, you mentioned something about predictive coding and top-down modulation for sensation. Can you simplify that a bit?
Sure. Think of your brain as a prediction machine. It's constantly trying to guess what's going to happen next based on past experience and current context. That's sort of the core of predictive coding. Top-down modulation, then, means that your higher cognitive functions, your thoughts, beliefs, expectations, can actively influence or reshape how you perceive incoming sensory input, like pain or even shortness of breath in asthma.
So if I expect less pain,
Your brain can actively turn down the volume on the incoming pain signals it receives from the body. It literally makes the pain feel less intense. It's not just passively receiving information, it's actively constructing your reality based partly on expectation. So the brain doesn't just believe it biochemically acts, it filters, it alters. Okay, that's a profound summary. The brain doesn't just believe it biochemically acts, it perhaps even rewires itself, at least temporarily. So, okay, we know it works, we have a much clearer picture of how it works. But what makes this neuromanifestation stronger or weaker? Are there things that can amplify it or diminish it?
absolutely. Researchers have identified several factors that seem to modulate the strength of the placebo effect. Some are quite surprising. For example, invasiveness seems to matter. A sham injection, even if it's just saline, often produces a stronger placebo effect than taking a sham pill.
Really? Just the act of injection?
It seems so. There's something about the ritual, the perceived potency or seriousness of the intervention that enhances the expectation and thus the effect.
Wow. Okay, what else?
Price and branding play a role, believe it or not. Studies have actually shown that placebos presented as being expensive or having a recognizable brand name are often rated as more effective by participants than identical placebos presented as cheap or generic.
So we literally get what we pay for, even when it's nothing.
It seems our expectations are influenced that way. Even the color of a pill can matter. Research suggests red or yellow placebos are often perceived as more stimulating, while blue or green ones are seen as more calming or sedating.
That's amazing. So many subtle cues feeding into it.
Exactly. The whole context matters. And maybe one of the most important and perhaps most heartening amplifiers is clinician warmth. How the doctor or therapist interacts with the patient. Studies, particularly some of those open-label placebo trials for IBS, have shown that having supportive, empathetic, and compassionate interactions with the clinician can literally double the size of the placebo effect compared to a more neutral interaction.
Double the effect, just from warmth and empathy.
That's what the data suggests.
Ah.
That human connection, that feeling of being genuinely cared for and listened to, seems to be a powerful therapeutic ingredient in itself.
That's such a powerful reminder of the human element in healing, isn't it? But, okay, if positive expectations can amplify good effects, what's the flip side? Can negative expectations also manifest physically? Is there a dark side to neuromanifestation?
There absolutely is, and that's what we call the nocebo effect. It's essentially negative neuromanifestation. This is where negative expectations, warnings about side effects, or even just anxiety about a treatment can lead to the experience of real negative symptoms.
So, if I expect a side effect, I might actually get it, even from a sugar pill.
Precisely. A really powerful example comes from statin trials, drugs used to lower cholesterol. Muscle pain is a known potential side effect. In some studies where patients were carefully informed about this potential risk, a significant number one analysis found it was around 26% of patients taking the placebo reported experiencing muscle pain.
26% got muscle pain from a placebo, just because they were warned about it.
Yes, they experienced the very side effect they were told might happen, even though they weren't getting the active drug. It starkly illustrates how our mind-body connection is a double-edged sword.
Right.
Our expectations can manifest both positive and negative outcomes.
That's crucial, the double-edged sword of expectation. Okay, if we sort of pull back and connect all of this to the bigger picture, understanding neuromanifestation properly seems like it has really profound implications. Not just for us as individuals trying to understand our health, but for the future of medicine, clinical trials, patient care, the whole system.
Indeed it does. Let's take clinical trials first. A strong placebo response, which we now see as common, can actually complicate things significantly. It can inflate the apparent effectiveness of a new drug if the trial isn't designed carefully. It makes it harder to see if the drug is really working significantly better than just the expectation and context.
So a drug might look good, but only because the placebo group also improved a lot.
Exactly. This is a particular challenge in areas like psychiatry and pain management, where placebo responses are often especially high. Drug developers are very aware of this. To counter it, trials are increasingly adapting. They're using more sophisticated designs, like having a placebo run-in period at the start. It's where everyone gets a placebo for a short time initially. This helps identify and sometimes exclude individuals who show a very large improvement on placebo alone. The idea is to get a clearer signal of the drug's specific effect later on. Or they use add-on designs where everyone gets standard care and the new drug is compared to placebo on top of that.
Okay, so it forces drug development to be even more rigorous to prove true efficacy above placebo. That seems like a good thing. And beyond trials, what about actual day-to-day clinical practice? How does this understanding open up possibilities for doctors interacting with patients?
It's incredibly exciting, I think. First, it validates the ethical harnessing of these effects through things like open-label placebo. It shows patients can benefit from activating these internal healing mechanisms without any deception. Honesty works.
So doctors don't need to feel like they're tricking anyone.
Not at all. It also highlights just how critical, careful, positive communication is. How clinicians frame risks, discuss potential side effects, doing that thoughtfully can actively reduce nocebo harm. Instead of just rattling off a scary list, framing it more constructively matters.
Right. Focusing on potential benefits, framing risks appropriately.
Yes. And fundamentally, it encourages us to see the value in the therapeutic encounter itself. The rituals of care, the empathy, the active listening, the genuine patient engagement, these aren't just nice-to-haves. This research suggests they can be thoughtfully integrated with standard biomedical treatments to genuinely maximize positive outcomes.
So it's about creating a more holistic, person-centered approach, combining the best of science with the best of human connection.
Precisely. It acknowledges the patient's powerful internal capacity for healing and works with it, alongside whatever external treatments are necessary. It's about the whole picture.
Okay, before we wrap up and leave you, our listener, to mull over these pretty mind-altering revelations, let's quickly pull out a few of the most astonishing data points again, just to crystallize things. First, pain. Remember, significant subjective relief, measurably blocked by naloxone, showing your brain actively creates it using its own internal opioids. Then depression, that huge 30–40% placebo response rate, accounting for maybe 60–70% of total improvement and activating the exact same mood-regulating brain circuits as antidepressant drugs. Parkinson's, direct visible dopamine release in brain scans from a placebo, leading to temporary motor improvements. Belief becoming biochemistry. And the boundary case? Asthma. Subjective breathing felt better, but objective lung function didn't change. A key distinction between perception and physiology. And maybe the most startling, that knee surgery study. Sham surgery turning out just as effective as the real deal for pain and function, highlighting the immense power of medical ritual and expectation. And finally, perhaps the most revolutionary, open-label placebo for IBS, proving you don't even need deception for this powerful mind-body connection to deliver real, measurable relief. So we've really come full circle, haven't we? Completely redefining what placebo means. The core insight seems crystal clear. The placebo effect, or as we've called it, neuromanifestation, it is far, far from being all in your head in a dismissive way. It is a profound, measurable neurobiological phenomenon where your belief, your expectation, the meaning you derive from a situation actively triggers real changes in your pain, your mood, and even your physical function.
And that really brings us to a final provocative thought for you to consider as we finish this deep dive. By reframing this not just as placebo, but as neuromanifestation, we start to recognize that medicine isn't solely about molecules and mechanisms. It's also profoundly about meaning, about context, about belief, and about the incredible innate capacity of the human mind and body to influence its own state. So consider this. How might this deeper understanding transform not just how we approach patient care or clinical trials or doctor-patient interactions, but also how you perceive the powerful, tangible connection between your own mind and your own body day to day? What new possibilities does this open up for you in your health journey or just in your understanding of human potential?